Hello, everyone. My name is Long-Jing from Indiana University, Bloomington. I'm presenting on behalf of Christina Chung from University of California, Santa Cruz, on designing technology that supports the multifaceted roles of caregivers for older adults. Before we begin, let me ask you a question. What is the first image that comes to your mind when you first hear caregiver for an older adult? Search engine results for caregiver often shows a person holding one's shoulder, reading something, dressing someone up, pushing a wheelchair, or even holding hands. However, the caregiver's role often is not only holding hands with older adult care recipients, it is multifaceted. For example, a female caregiver for one's family member can also be a wife, a colleague, communicator to the doctor or other family members, a self-carer who needs time for themselves, and also a mother for a child. And thus, prior literature described the care ecosystem, not only the other roles that the caregiver have, but also specific roles that they have to portray in order to care for an older adult. So in this example, Francisco and Sergio in 2021 described the caregiving ecosystem in Latin American families. They identify the factors that are related to each other, according to caregiving requirements, the willingness of family caregivers, caring capacity of family caregivers, and the roles assumed by family caregivers and caregiving actions. Next, Yunnan et al. Also did a study that describes collaborative caregiving. So the left side represents a patient-caregiver interaction, and the right shows how our caregiver connects to others in real life. However, one thing that they may be missing is the invisible work that caregiver invests in managing the intricate care ecosystem and potential technology that support them in their multiple roles. In our research, we interviewed 19 informal caregivers ages 20 to 82. They are all informal caregivers of adults 65 or older living in the United States. We interviewed them for 1 hour, and we asked the participants about their caregiving roles and challenging aspects of care tasks and relationships. And through the interview, we not only discovered the caregivers' multiple roles, but also the challenges and strategies they employ in managing all these multiple roles. So in the paper, we discuss many different kinds of scenarios and case studies, but in this presentation, we'll use P3's experience to illustrate how the multiple roles are difficult to manage and what are some of the challenges they encounter. So first, we describe P3. P3 is a female, 65 years, who recently retired from a bustling city. She then moved to a rural area with her husband for a retirement life. Her mother, who's at the age of 95, used to live alone and independently, but not until her mother experienced serious falls and hallucinations with dementia. At that point in time, she and her husband decided that they recognized that something had to be done and invited her mother to their place. However, things are not as pleasant as expected. First, she sometimes struggled to decide when and how to perform potentially conflicting roles. So she has the conflict in becoming a caregiver for her mom with all this responsibility, but also the daughter's responsibility to respect her mom's agency. So in one example, the caregiver said, I have to remember that she's not a child, she's an adult. And so just making sure that her opinions are, taken care of. Not only this, she also have to manage time and responsibility among multiple roles. So she's not only her mom's caregiver, but she's also her husband's wife. She initially wants to retire with her husband and have a happy retirement life, but also she has this responsibility with her mom. And she has to manage her time efficiently. And in this example, she told us, a lot of times, first thing in the morning, we'll take a swim. My husband and I usually always go out and around when the weather's nice. We go out usually around 3:30 and we're in the pool from like 3:30 to 5:30. So here she's explaining how her swimming schedule has changed because she wants to swim with her husband, have some alone time, but at the same time, she has to fulfill her mom's caregiving responsibility. Next, She also have to learn how to adapt and transition between the caregiving roles. P3 have mentioned in the study that her mom used to be a very friendly and sweet mother, and they used to be very close. But as time passed and her mom's dementia get worse, her mom become very unsatisfied in all the kinds of activity they provided and become very frugal, which is a very different kind of personality from her used to know mother. She told us, I don't think any of us saw that coming. I mean, honestly, she and I used to be pretty close. I don't think any of us thought she would be unhappy as she is. Here she demonstrates how difficult it is for her to see her mom changing her personality and also as a caregiver. So hence, we have described the three different kinds of challenges that the caregiver face. First, deciding when and how to perform potentially conflicting roles. Next, managing time responsibility among multiple roles. And then adapting and transitioning between caregiving roles. How can technology help then? In the paper, we describe the design implication for caregivers' multifaceted roles. And hence, these are the three design implications. First, the caregivers may struggle to decide when and how to perform each role, each potential conflicting roles, such as P3's caregiver versus the daughter role. And we suggest to identify, reflect, and coordinate to navigate the potential conflicts in individual roles that technology can help. In such case, we propose that technology can help identify, reflect, and coordinate to navigate potential conflicts in individual roles. So the technology could help to consider how each role is performed and find a middle ground when conflicts arise and finding a communication in a manner that aligns with both roles. Next, in our research and previous studies, the caregivers often feel that they're not doing enough for their various roles that they have, such as a husband's wife, a mom's caregiver, or other responsibility. And we suggest technology to help in role-based scheduling with acknowledgement to maintain a balance while alleviating guilt. So acknowledgement can be encouragement mechanism within the scheduling process to help caregivers recognize and emphasize their value of invisible work. Lastly, the caregiver also struggle with adapting and transitioning between caregiver roles, such as P3 who struggle with her mom's personality change. Thus, we suggest technologies to help find gratitude and positivity while they are having these role transitions. So for example, P3 from case study 2, the system could prompt her to cherish the moment they shared at home and emphasize the positive aspect of evolving roles and expectations within the caregiving ecosystem. With this, we come to our conclusion that it is important to understand that informal caregivers usually have multifaceted roles and filial obligations that are compounded challenges and that make their caregiver tasks more challenging. And sometimes balancing these multiple roles requires invisible works and responsibilities that will require some help. An HDI design can support navigating potential conflicts in individual roles, designing role-based scheduling to balance and alleviate guilt, and finding gratitude and positivity during role transitions. Lastly, we would like to say that the caregivers may have all these problems, but technology can help as they are dancing with the roles. Thank you for listening. Please check out our paper for more information or email us or send us a message in LinkedIn and contact us for further information. Thank you.